Hello, my name is Dr. Punika, and this is a MRCP PACES Station 1, the Neurology section. You get 10 minutes altogether. The first 6 minutes are for examining the patient, and the following 4 minutes are for discussion with the examiner. Hello, Dr. Dhar.
Hello.
My name is Dr. Punika. I'm your MRCP examiner today in this Station 1. We have got a neurology station. Please come. Laura is a 20-year-old patient who has been referred urgently by her GP to the neurology clinic. She has had right-sided sensory symptoms for the last 24 hours. Please examine her neurologically in the upper limbs.
Thank you. Hello, Laura.
Hello.
I'm Dr. Dhar. I'm one of the neurology trainees.
Okay.
Would it be okay if I examine the nerves of your arm and hand? Okay. I'm just going to take a step back and have a look at you and around, if that's okay.
Yeah.
Thank you. You could have a look at your neck. I'm just looking for any scars, any pigmentation, muscle bulk. If you could turn your palms up. Thank you. That's fine. Do you have any pain anywhere?
No pain.
If I cause any pain, let me know, please. Okay. So if you could put your arms out like this, okay, and close your eyes, please. That's fine. Rest your arms down now. Okay. I'm just going to check the tone of your muscles. So if you could go nice and floppy for me. Okay. Thank you. Now I'm going to check the power of your muscles. So if you could make a wing like this for me. Okay, don't let me push you down. Now push down on me. Excellent. If you could do a boxer like this. Push me away. Again, push me away. Now pull me towards you. Pull me. Excellent. Again, if you put your arms out and then cock your wrist back up. Don't let me push you down. Now, don't let me push you up. Again, if you could spread your fingers out. Don't let me push your fingers in. Okay. Now, palm this way. And if you could point your big finger this way. Yep. Don't let me push you down. Excellent. Now I'm going to check the reflexes, okay? It's not going to hurt you. Bend your arm slightly. Thank you. With this finger, can you touch your nose, please? And then touch my finger, back and forth. That's fine. If you could do the same with this finger. That's fine. Now, if you could place your right palm over your left palm, turn it over, back again, and do as quickly as you can. Excellent. Now, swap your hand and do the same. Excellent. Thank you. Now I'm going to check your touch sensation, okay? So let's have a feel first here. Can you feel it?
Yeah.
Did it feel soft?
Yeah.
Okay. So I'm going to touch you at several points. So as soon as you feel, let me know by saying yes, okay? And if you could put your arms out like this way. Excellent. Close your eyes, please.
Yes.
And did it feel same on both sides?
Slightly less on the right than the left.
Okay.
Yeah.
Do you feel same?
Again, slightly left on the right. Less on the right than the left.
Okay.
Yeah. Yes.
Do you feel same?
Slightly less on the right than the
1
left.
minute remaining.
Yes.
1 minute more.
Yes. Yes.
So do you always feel less on the right
Less
side?
on the right.
Okay, that's fine. Now I'm going to check your pain sensation. So it shouldn't hurt you. How do you feel? Do you feel sharp?
Yeah, sharp.
Close your eyes, please, and let me know when you can feel it.
Okay, I felt something then.
Do you feel same on both sides?
No, the left is sharp, the right isn't.
Right.
Yeah, but it wasn't sharp. Again, the left was sharp, the right wasn't.
What about now?
The left was sharp, but the right wasn't.
Okay.
Mm.
Right. So it's a bit less on the right side. Is that right? Yeah. You can
Yeah.
open your eyes now. Can you feel it vibrating? Not the touch, but the vibration.
Yeah.
Okay. Right.
Okay, stop. Thank you.
Thank you. In order to complete my examination, I would like to examine the lower limbs and also cranial nerves.
Okay,
And
good.
also, I will check the proprioception of the upper limb.
Good. Okay, would you like to present your case, please?
Sure. On examination of Laura, 20-year-old lady, I found the neurological examination of the upper limb was normal except loss of touch sensation and pain sensation
On which side?
on the right side, and I would like to complete my examination carrying out proprioception and rest of the neurological examination.
Okay. Right, so you have found sensory deficits in the right upper limb. Would you like to give me any causes that go through your mind?
Sure. First, I would like to exclude cerebral stroke, either an infarct or bleed.
Okay.
And then I will have several possibilities to consider as well, such as
Okay, let's just stop there. She's 20 years old. Would you like to think of a cerebral infarct or a bleed? Yeah?
yes, I would consider that, but before that I will need to take history
Okay.
and do a detailed examination.
Okay, well, what if I tell you that she's actually a squash player and she has been busy playing squash yesterday before this started?
Well, that would let me think that is there any dissection in the possibilities?
Okay,
So cerebral, yeah, either intracranial or cervical dissection.
okay. Say for example, if this is cerebral infarct, what investigations would you do?
Initially, I would arrange a CT head
Okay,
or an MRI brain depending on the logistics, and
Okay.
I will also arrange some form of imaging for the blood vessels,
okay,
which could be a T1 fat suppressed signal for the cervical arteries
okay,
and
to
also
look for
intracranial
what?
arteries to exclude any dissection.
Okay, that's good, okay. What other investigations would you organize?
Considering stroke as a possibility, I would obviously investigate her for risk factor, including fasting blood glucose,
Okay.
hemoglobin A1C, lipid profile,
Okay,
autoimmune profile, considering she is very young,
okay,
and thrombophilia screen,
okay,
particularly if there is any positive family history. I will do
Okay.
an ECG,
okay,
possibly a 24-hour ECG,
okay,
and a bubble contrast echocardiogram.
right. What are you looking for on a bubble contrast echocardiogram?
To basically think about any cardioembolic source, which could be because of a patent foramen ovale and intra atrial aneurysm.
Okay, okay, that's good. Let's move on. You've done an MRI scan of a brain and you have excluded a cerebral infarct or even a hemorrhage as a cause of a symptoms. What other conditions might present in this way?
Another possibility would be migraine. So
Okay.
it might be that after migraine she is in the resolving state
Okay,
where the sensory symptoms are going to resolve soon.
okay,
And the second possibility, as we discussed, could be cervical artery dissection.
okay,
And those would be the main differentials that I would like to...
Would you consider anything else? Say for example, if her onset of symptoms was not very sudden.
in that case, demyelinating disease such as multiple sclerosis, considering she is young and female.
Okay. Okay. Well, another piece of history that I have found with Laura is that she's been taking the oral contraceptive pill for the last 4 years, and she has been having headaches for the last 6 months. Would anything else go through your mind?
Sure, that will let me investigate her for cerebral venous sinus thrombosis, which can sometimes present with focal findings.
Okay. Right. What investigation would you consider to rule out cerebral venous sinus thrombosis?
So the gold standard would be a venogram, but there are other imaging that we can arrange, such as MR venogram or
okay.
CT venogram.
Good. Thank you. Thank you. That's time. Right, so we've done the scenario on the neurology station 1 of the PACES exam. What are your feelings about how you performed?
Yeah, I mean, reflecting on the case that I was examining the young lady, I think there are quite a few things that went well, such as I washed my hand before examining.
Absolutely. Yeah.
I took her permission,
Yeah.
and I didn't hurt her.
You did ask her whether
there was any pain anywhere.
Yeah.
So those things I think went well.
and
Although
those things are very important.
It is certainly.
They are, because it's absolutely important that you show to the examiners that you wash your hands, you take permission, and you ask if they are in pain.
Yeah, absolutely. In terms of the actual examination, I wish I could finish all the components of the exam. I did the motor exam complete, and when I was doing the sensory exam, there were a few things that I couldn't cram in within the time, such as proprioception, temperature, sensation.
Okay.
Yeah, I wish I had the time to complete them.
Okay. Okay. Yeah, I mean, I think your performance was good, to be honest. You looked systematic, slick in your performance, and confident. And at the end of the examination, you did offer to me that you would have done the proprioception. And also, when it came to the discussion, I think it was a good discussion, and you answered all the questions quite appropriately. And I think the differential diagnoses, the list, plus the investigations were all quite in the right direction. So I would give it a pass, to be honest. So what do you think, apart from what we've discussed just now, would you like to add anything else from your experience from the PACES exam?
Yeah, sure. I mean, in my real exam, the case that I was asked to examine in the neurology station was an upper limb examination.
Oh, I see, okay.
Yeah, and even there I couldn't finish everything. I think there was 1 or 2 in the sensory exam that was left out. But whatever I did, I think I did it methodically.
Okay.
In a sleek way, as you were saying.
Okay.
So that's very, very important, that candidate should come across quite confident.
Okay.
And they should, when they're presenting, they should present in a very articulate way.
Okay. Yeah.
Leaving out the unnecessary detail.
Yeah.
Only mentioning the positive findings and 1 or 2 important negative findings. So yeah, very sleek, systematic examination, confident, safe looking, somebody who knows that, you know, they have done it in the past for many times. Those are absolutely critical. And in the beginning, as I said, this, you know, initial few things we should all know, but sometimes we can get a bit comfortable knowing that, you know, these are the things we take for granted, such as taking permission from the patient, washing hands, and make sure that they're not in any pain anywhere.
Okay.
If they're in pain, make sure that, you know, you go very gentle.
Yeah.
Yeah, so those things are very, very important for passing exam.
Yeah, absolutely. I would just agree with all that you said, and just add from my side that a candidate who has practiced well, comes across as very slick, systematic, and confident, and these are the people who are going to pass the exam.
If there is one thing I could add on, is that sometimes people think that if they leave out one component of the examination, that's the end of it. That might not be.
Okay.
And sometimes examiners might alert them that what would you like to do more?
Right.
Or is there
okay.
anything you want to do more? If they can mention it, that might not be an instant fail.
Okay.
Whereas not able to get consent or not able to wash hand,
Okay.
that might make an instant fail.
Okay.
So, yeah,
Good. Thank you.
thank you.